Assalamualaikum guys, welcome to my YouTube channel which is related to your pharmacology. I hope that you all are doing good and well. So today we are here with the basic and important topics of the pharmacology, which are basically the drugs related to your subjects. So today we start with the our topic, which is the local anesthetics. So what are the local anesthetics? These are the drugs which upon topical application or the local injection causes reversible loss of sensory perception, especially of the pain in a localized area of the body. Block generation and conduction of the nerve impulses at a localized site of contact without structural damage to the neurons, loss of sensory as well as motor impulses, and they do not cause the loss of consciousness when administered correctly. This one is the structure of the local anesthetic. You can see clearly in the picture. Further, its chemistry, there are three major parts of local anesthetics are the aromatic ring, intermediate chain is of amide or the ester and amine group. First of all, we have the classification and basis on the duration of the action is short acting, which is 20 to 25 minutes, which are the procaine and the chloroprocaine. Intermediate acting 45 to 60 minutes, which are the lidocaine, prilocaine, lignocaine, cocaine. And the long acting 2 to 3 hours, which are the bupivacaine, ropivacaine, atidocaine, tetracaine. Further, we have the classification of the local anesthetic based on the chemical nature. Esters containing cocaine, procaine, tetracaine, benzocaine, and amides are the lidocaine, mepivacaine, bupivacaine, and atidocaine. Classification of the local anesthetics, amides and esters. Amides produces more intense and the long-lasting anesthesia. They are not hydrolyzed by the plasma esters and rarely cause hypersensitivity reactions. But esteramides have a short duration of action and less analgesia, and they are hydrolyzed by the plasma esterases and high risk of hypersensitivity. We have the properties of the ideal local anesthetics, which is reversible in the action, non-irritant, non-allergic, non-systemic. Toxicity, rapid onset of the action, sufficient duration of the action, potent, stable in solution, no interfere with healing of tissues, should have vasoconstrictive action and not expensive. Further, we have the mechanism. The primary target of the local anesthetic voltage activated sodium channel is one of the numerous membrane protein which reside in the phospholipids bilayer encapsulating the neurons. They block the vasa, reduce the sodium influx, no depolarization, no conduction of active potential. They are the more lipid soluble form, more effective intracellular concentration inside the neuron, ionized form is more effective. This is the mechanism of action of the picture you can see here. Further, we have the pharmacokinetics of the local anesthetics is the absorption is determined by the absorption site, dose, rate of injection, pharmacological properties, plasma concentration. Okay, first pass pulmonary metabolism limits the concentration of the local anesthetics. Factors affecting the absorptions are the site of injection, dose, physiochemical properties, and addition of epinephrine. Their distribution, tissue distribution is proportional to the lipid solubility and the blood supply. They are distributed typically in the brain, heart, liver, and the lung, but slowly distributed, which have the low blood supply, like the muscles, adipose tissues. Further, we have the metabolism. Metabolism is dependent on hepatic blood flow. Toxicity of amide is more likely with prolonged infusion in the sick elderly patient, and their excretion is through the kidney. Lidocaine, its concentration is 2%, potency is 2x than procaine, toxicity is 2x than procaine, metabolized in liver, excreted by the kidney. Time of onset is 2 to 3 minutes and half-life is 90 minutes. Mepivacaine concentration is 2 to 3%, potency is 2x than procaine, toxicity is 1.5 to 2x than procaine, metabolized in liver, excreted in kidney. Time of onset is 2 minutes, half-life is 1.9 hours. Bupivacaine concentration is 0.5%, metabolized in liver, excreted in the kidney. Onset of action is 5 to 10 minutes and half-life is 2.7 hours. Procaine concentration is 2 to 4% and metabolized and hydrolyzed in the plasma, excreted in the kidney. Onset of action is 6 to 10 minutes and duration of action is 2 to 3 hours. Procaine is strong vasodilation, very short duration of anesthesia, high incidence of allergic reaction, drug of choice. Consider for the mild allergic patients. An importance of adding vasoconstrictor in local anesthetic is that vasoconstrictor constrict the blood vessels, decrease the blood flow. decreases the blood level of the drug, increases the concentration of the drug at the site, decreases the bleeding at site, increases the duration of the drug. So guys, this is our video on the topic of the local anesthetic containing all the drugs of the short acting, intermediate and the long acting. So I hope that you can clearly understand the concept of the local anesthetic and their mechanism of action. So go and like my video, subscribe my channel, and wait for other important videos related to the pharmacology subject. Till Allah Hafiz, take care.